So what is hydatid cyst? Hydatid cyst, also known as hydatid disease, echinococcus or dog tapeworm. Actually, it is a parasite infection which mainly affects the liver, but it can also affect other part of the body. It is mainly animal infection, which is also known as zoonosis, and it's the major cause of echinococcus or hydatid cyst is echinococcus granulosis. But there are other species which can also cause hydatid cyst, which are echinococcus vogeli, echinococcus oligarthus, and echinococcus multirocularis. The one thing related to echinococcus multirocularis is that it can cause malignant hydatidosis, which means that multiple organs are involved, and in one organ multiple cysts are there. And if we talk about the life cycle of hydatid cyst, then the definitive host being in which sexual phases are occurring are the dog, and intermediate host are sheep, and the intermediate end host are men. So hydatid disease is spread by the dog feces, and when dog feces get in contact with the vegetable or food, and that vegetable or food get ingested by the men, then the egg of echinococcus convert into larvae or oncosphere, which is then absorbed by the mucosa of the GIT, mainly in the duodenum. And when that oncosphere or larva absorb in the duodenum, then it follows two pathways. Either it can go into the portal vein or into the inferior vena cava. If it go into the portal vein, then it affect the liver. But if it go into the inferior vena cava, then it through the heart, it can affect the lung, spleen, kidney, brain, and bone marrow also. So there are 75% chances that echinococcus affect liver, and 25% chances it can affect other than liver. It can affect to lung, spleen, kidney, brain, and bone marrow. So one thing is related to echinococcus is that the scolix, that is an interior part of the tapeworm, it occur in definitive host in the adult tapeworm, but scolix in intermediate host occur in newly formed cyst. If we talk about the part of hydatid cyst, then it mainly consists of three parts: pericyst, endocyst, and ectocyst. Pericyst is the host tissue, and the ectocyst is the outer gelatinous membrane, and the endocyst is the inner germinal membrane, you can say. So pericyst actually is the main thing which provide nutrition to the inner two membrane, that is ectocyst and endocyst, via diffusion. If pericyst gets calcified, or you can say gets ischemic, then the cyst can be destroyed. So there are mainly three ways in which cyst can be destroyed. The one is that if the formation of cyst vacuole or the pericyst or gets calcified, or degeneration of membrane occur, then cyst can be destroyed. One thing that I really want to highlight, that WHO divide the hydatid cyst into three categories: group 1, group 2, and group 3. If hydatid cyst is more than 2 cm, it's often fertile, then it will go with group 1. And if hydatid cyst is in group 2, then it is a transition group, and in that group hydatid cyst mostly start to degenerate or partially degenerate due to the host response or due to treatment, and but it contain often protoscoliosis. And in group 3, that is the inactive stage or inactive group, in which hydatid cyst totally degenerate, or it is contain no evidence of protoscoliosis. And if we talk about the symptom of echinococcus, then mostly it is asymptomatic. If the symptom are occur, then mostly patients present with shortness of breath, tachycardia, hypotension, then swelling in the right upper quadrant of the abdomen, and severe abdominal pain. Now the question is that if the hydatid cyst is asymptomatic, then how patient is present? So as I described earlier, that if a patient came to you with in the emergency department with history of abdominal swelling, or in the upper right quadrant, or the severe abdominal pain, then severe abdominal pain and history of you can say farmer, then you think about hydatid cyst or hydatid disease. And if the patient came to you with anaphylactic shock symptom without any of food poisoning or bee stings, then you can think about hydatid cyst. But the thing is that you mainly notice white material in the patient and cough, which contain scolix or scolic-like part, which mainly come from the ruptured hydatid cyst. So if we talk about if the patient came to you with these symptoms or these history, then you can diagnose hydatid cyst. Proper diagnose, you can perform CT scan, MRI, ultrasound. In ultrasound, we can see abnormality in the bile duct or gallbladder. And in CT scan, if the hydatid cyst occur in the liver, we can see smooth space occasionally septa, and we can also see the honeycomb appearance in the CT scan if hydatid cyst occur in the liver. But if hydatid cyst occur in the lungs, we can see water lily sign or crescent sign in radiograph. If we talk about the treatment, then mainly we perform mainly is the surgical removal of the cyst, but we can also use drugs like albendazole, and anti-helminthic drugs, mean anti-parasitic drugs, which benzimidazole. And during surgery, if hydatid cyst gets ruptured and fluid leak into the abdominal cavity, then it may cause anaphylactic reaction. And if you feel any kind of flushing reaction, edema, tachycardia, or hypotension, then you have to go with anaphylactic management. And in anaphylactic management, you have to give 100% oxygen with bronchodilator and a histamine blocker with the injection of adrenaline or norepinephrine.